President Trump publicly declaring a war on the opioid epidemic. Overdoses of the drug have claimed the lives of hundreds of thousands of Americans in recent years.
President today calling it a, quote, public health emergency. Omar Jimenez tells us what the declaration means for those communities dealing with the deadly crisis.
We can be the generation that ends the opioid epidemic.
President Trump declaring war on the opioid crisis.
This epidemic is a national health emergency.
The order under the Public Health Services Act will direct federal agencies to give more grant money to fight the epidemic, but stop short of declaring it a national emergency, as Trump recently promised.
In terms of declaring a national emergency, which gives us power to do things that you can't do right now.
The difference, money and scope. A national emergency would have allowed the government to tap into federal disaster relief funds. Administration officials argue that money is better suited for national disasters like hurricanes. And while no additional federal funding will be automatically directed to the crisis, it will allow lawmakers to increase federal funding for the problem in year-end budget deals being negotiated in Congress. The impact of opioid addictions touched nearly every corner of the U.S.
Every time they give me more, my body just get immune to it. But then if I didn't have it, I get sick.
Officials say the number of deaths related to opioid overdoses is 4 times the amount it was in 1999. According to the Centers for Disease Control and Prevention, more than 140 Americans die every day from an opioid overdose.
Nobody has seen anything like what's going on now. As Americans, we cannot allow this to continue.
In Washington, I'm Omar Jimenez.
In a statement, Governor Holcomb applauded the president's decision. He also said it will take an all-hands-on-deck approach with local, state, and federal partners working together to attack this epidemic. Today, our state is engaging every resource at our disposal and using a 3-pronged approach to tackle the problem with prevention, treatment, and enforcement.
Senator Donnelly also speaking out, saying he supports the president's decision to declare the opioid crisis a national emergency here in Indiana. We have seen a major spike in overdose deaths. State leaders say the number of people who have died due to drug overdoses has quadrupled since 1999. I spoke with Donnelly about the president's announcement.
We'll take any help that will be provided. At the present time, I was able to obtain $11 million in additional funding for Indiana last year in the 21st Century Cures Act, funding that would be used for addiction treatment centers. I was able to work with Senator Kelly Ayotte from New Hampshire on changing prescribing practices. We're working on trying to put in place telemedicine programs for our rural communities that they can, through telemedicine, call into, for instance, Methodist Hospital in Indianapolis to talk to a professional about mental health assistance. And so hopefully the president, by doing this, will bring more resources to the battle as well.
Indiana University also getting involved in the fight. The school is devoting $50 million over the next 5 years and more than 70 researchers to help solve the problem.